After I die and donate my dick to science, doctor's gonna be like... Get ready to laugh because today we are breaking down and reacting to some of the most unhinged Discord medical memes out there. All right, let's dive right in. Doctors before stethoscopes were invented. Yes, exactly. You can put your ear on somebody's chest and you can hear their heartbeat. You can hear the lung sounds. Yes, it's creepy. Imagine your doctor was doing this to you. Probably not appropriate at all. But in a pinch, if you don't have a stethoscope, there are other ways you can do this. Probably a more appropriate thing would be to put your ear on somebody's back instead. Maybe not their chest, but you'll be able to hear very similar sounds. But you can also like gently put your hands after you ask permission from the patient. You can put your hands on their back and actually ask them to breathe. America on prolonging erections. America on mental health. Oh my gosh. It is very interesting. America, any country basically doing scientific research, there is a potential reason behind it, right? Why? Is there money behind it? Is something easier to accomplish versus something harder? There's a lot of different factors, okay? So yes, prolonging an erection, right? Quick, easy, simple pill. Mental health, a much bigger problem. So sometimes not just because there might be money involved, but because it's actually an easier problem to solve, people might actually tend to go to that one versus something that's a very hard issue. Anatomy exams be like, identify this nerve. Yes, okay. Who hates when all the Christmas lights get all tangled and you got to figure it out? I remember in medical school when I took anatomy, gross anatomy, the professors would literally jumble things up, twist them, move them, make them backwards. And you have to identify what it is. And you have to look, you have to see where it's coming from, where it's going. It is actually something that the professors do when trying to test your knowledge in this area. Ask a surgeon out there. They will tell you that there are many anatomical variants from person to person. Paralyzed man gets up. Blind man, yo, did he just get up? Mute man, did he just see? Deaf man, did he just talk? Doctor, baffled. Pretty impressive. Things do happen to where people who are paralyzed, they are able to get function back. Blind, that is a different story. They haven't actually gotten to the point yet that I know of where you can make a blind person see again. Mute individuals have the ability to sign language, depending on what the mechanism of why they can't speak. That's the underlying issue. So is it related to the fact you don't have a voice box? And then deaf man, okay, obviously we have the ability to do different procedures to actually help individuals heal. Help, I need CPR. CPR. Crab Rangoon, put right in my mouth. CPR does not stand for that. It stands for cardiopulmonary resuscitation, right? Heart and lung resuscitation. But at least we got an image that shows that we're close to the appropriate position of where your hand should be for CPR. And then hopefully somebody else is calling 911, asking for the AED, and doing potentially either hands-only CPR, or if people are trained to be able to do partner or two-person CPR. Me thinking with my dick versus me after post-nut clarity. What does this actually mean? Sometimes you're thinking with the wrong head is another way we state this. You're thinking about the nether regions and your decision making is more skewed due to those indulgences versus after that's taken off the table, then you have a little bit more clarity of what else that I need to do and be in depth about it versus being so distracted. Be aware of that. But again, it's our body and our mind connection and understanding how it is not used against us, but it distracts us. When you're feeling sad, remember this vertebrae, C6, and how happy it is to support you every day. Yes, this is your vertebrae, and so the big mouth component, that's where your spinal cord runs down through. The holes on the side is where the blood vessels cruise through, and then so the anterior part, or the bigger piece, like say the forehead, would be kind of like your vertebral body, and then all the other components are supporting and having articulating surfaces with other vertebrae, your discs, as well as any other supporting structures. It's right behind me, isn't it? That's really funny. Different vertebrae, how they're actually aligned, and the different numbers that we have, right? So we have 12 ribs. You have 10 ribs plus 2 floaters. And so yes, this is quite normal for the spine to curve like this. So in the thoracic spine, you have kyphosis, where you have the hunchback, right? And then in the lumbar area, as well as the cervical, it bends the opposite direction. We call that a type of lordotic curve, okay? And typically it has to do with what those areas are supposed to be doing, as well as balance and supporting the body. It took me like 2 seconds to actually understand this. But no, a stool sample, meaning poop, stool, and we want a poop sample. Really hard to target a poop sample into a medicine container. Usually there's ability to do this where you like poop on a piece of paper or into like something plastic that's larger that collects it, and then you just take a small sample and put it in there. Typically, why would we actually want a stool sample? You're looking for blood, you're looking for parasites, you're looking for different types of viruses or bacteria that are in there. So AKA cancers or infections. My nose during a cold, left nostril, right nostril. Yes, this happens quite often. Sometimes one nostril might be clogged and the other one might be running faucet. People do a lot of sniffing when they have a cold to try to prevent it from coming out, but that increases the risk of it going into your eustachian tubes, going into your middle ear, as well as going into your sinuses and causing sinus pressure. I always recommend people using a neti pot to try to clear out their sinuses, and then carry lots of tissues around, as well as some lotion for your nose to get all the snot out of there. The snot is protective. It's trying to clean up the pathogens that are causing an issue, and there's also some byproducts thereafter of the destruction of the pathogen. So get it out of there. 8-year-old me, after eating all of the extra Halloween gummies that mom hid in her medicine cabinet. That's not good. So one would think, okay, too much candy causing massive sugar surge, but I have a feeling, because this is actually quite common, unfortunately, that cannabis gummies appear to look like normal candy, and accidentally children will get into it if it's not properly stored away, and they come in stoned. Stoned is a term to where you have too much THC in your system and they are altered. Dangerous because we don't know exactly what they took, so you have to do a full workup to figure that out, and hopefully you're able to know that there's gummies missing. After I die and donate my dick to science, doctor's gonna be like, we all come in different shapes and sizes. On the average, most people are the same or very similar size. Yes, there is a bell-shaped curve to the very big and the very small. There are surgeries that could be utilized, I believe, on both ends. If you have a small penis that we call a micro penis, or that there's been trauma or disfigurement. Johns Hopkins University has a department relating to penile transplants. As an emergency medicine doctor, penile emergencies that we see, it's related to medication use or misuse, trauma to the area, bad infections. These memes were actually something I actually finally understood. I do enjoy them, so keep them coming, keep posting them. I will take a look at them and maybe throw them in a future video. So if you guys enjoyed this, definitely check out this playlist right here, binge watch everything, and please make sure to keep this channel running, subscribe, turn your bell notifications on, and hit that like button. Thank you so much for watching, and stay healthy, my friends.